Hi, I'm Stephen Grobmeyer, Chair of the Oncology Institute at Cleveland Clinic, Abu Dhabi. Welcome to the Fatima Bint Mubarak Center, where hope begins. This is an important building that was built specifically to address the important needs of patients diagnosed with cancer. Historically, when patients were diagnosed with cancer, they would travel from physician to physician to physician to get all of the care that they needed. We've specifically built this building around the needs of a patient. So the patient comes to one location and we provide all of the services with all of the doctors being brought to them to allow patients to have the best chance for hope of recovery and the best outcomes in a very patient-centered environment. Let me take you on a tour of our new building, which is specifically designed to meet the needs of cancer patients. We'll start on the first floor, where we've designed clinic spaces where multiple doctors can work together to meet the needs of newly diagnosed patients in the most efficient way. I'll also show you our dedicated breast center, which is providing the most modern care for women diagnosed with breast cancer. Let's go. This is the first floor of the Cancer Center. It's a facility specifically designed to allow teams of specialty doctors to work together to meet the needs of our patients. The patient comes to one place, the doctors come to the patient. Nurses are a vital part of the care we provide here in the center. This is Katie. She's one of the expert nurses that works with us in the care of patients here.
Here on level 1 of the Cancer Center, we have a group of specially trained nurses who understand that oncology patients have a specific journey and need special care coordination. Oncology patient journey is really important from diagnosis to treatment to aftercare, and here at Cleveland Clinic, the nurses are a vital part of that team with the physician.
Thank you, Katie. Let's go on with our tour of the building and let me show you the breast center. This is the Breast Imaging Center in the new Cancer Center. Breast imaging is vital to caring for patients with breast cancer. It's unique because this facility is attached immediately to the clinic. This is Dr. Matalka. He's one of the surgeons that works in the breast center.
Yeah, this is very convenient for the patient to be seen in the clinic, also to get their images at the same day. So we can review our patient's images with the radiologist in the same place. So make it very convenient and easy for the patient.
Next, let me take you to the second floor, where we provide medical treatment with infusions for our patients with cancer. It's a very important part of any cancer center. This is the second floor of the Cancer Center, which is our infusion area. We have many new drugs which are providing more hope than ever to cancer patients, and they're given here. This is Dr. Wissam. He's head of medical oncology at the Cleveland Clinic Abu Dhabi Cancer Center.
In Cleveland Clinic, we understand that patients who have cancer, they go through a lot of stress and many challenges. So in addition to providing the best expertise in physicians, pharmacists, and nurses, we also paid a lot of attention to details when we designed the room for the infusion center. We have 24 rooms in the infusion center. All of them are private. When we were designing it, we asked our patients, their relatives, our physicians, our nurses, and they came up with a conclusion: these are the best equipments that we can have to provide the best care for our patients. So our patients chose this chair, for example, the flat screen TV. We have beautiful view and a lot of sunlight, and this can help emotional status of the patients during receiving treatment.
Thank you, Dr. Wissam.
You are welcome.
This is the area of the infusional pharmacy, which is an important part of a cancer center. Let me introduce you to Ahmed Shakir. He's going to tell you about our pharmacy.
Thank you. Welcome to the pharmacy. Here in the CCAD pharmacy, we are using the state-of-the-art technology, starting from the automated dispensing cabinet, where all the medications are barcoded and secured to maintain the safety of medication administration, to the state-of-the-art sterile preparation center, where we have the chemotherapy robot. The chemotherapy robot is to prepare all the chemo medication to ensure the safety of the patients and the caregivers, also to make sure all the doses are accurate before it's administered to the patients. Thank you, Doctor.
Thank you for all the great work that you and your team do on a daily basis to keep our patients safe and make their treatment as effective as possible. Next, let's go down to P2, where we have our radiation oncology department and our Center for Advanced Cancer Imaging. These are two critical areas for the care of cancer patients. This is level P2 of the Cancer Center. It's home to our Advanced Cancer Imaging Center, where we offer state-of-the-art PET scans, MRI, CT, and ultrasound. These are modalities that are critical to help us diagnose and follow patients with a new diagnosis of cancer. The leader of the group is Dr. Fadi Giara. He's here, and I want to say hi.
Hi, Dr. Grobmeier. Thank you for visiting us, and welcome to our Department of Radiation Oncology. We are so proud to have this department and this technology available to our patients. Along with our team of experts that we assembled recently, we have done a lot of work and improving our flow and offering our patients the best technology we can offer. In this room, we have Ethos, very advanced radiation therapy machine from Varian Technology and Varian Medical Systems. And this machine actually has the capacity of delivering adaptive radiotherapy. Adaptive radiotherapy is a technology that provides the ability for our team to adapt not only to the position of the patient, but also to adapt the treatment plan according to the anatomy of the day, based on the motion of the organs and the filling of the organs, particularly for patients treated for pelvic and abdominal malignancies. We also have another machine, the Edge TrueBeam machine, that is dedicated for radiosurgery and stereotactic body radiation therapy. I think with the adaptive treatment that we can provide with Ethos and the stereotactic and SBRT technology that we can provide with the Edge machine, along with an additional technology that we have also, which is brachytherapy, able to deliver internal radiation therapy. With all these technologies together, we will be able to serve our patients in a very comprehensive manner and address the treatment of their malignancies with radiotherapy.
Well, thank you, Dr. Fadi. That was fascinating, and thank you for the work you and your team do to provide safe and expert care to all of our patients.
Thank you. Thank you for coming by.
This is the area in the Cancer Center where we do PET scans. PET scans are a very important modality for assessing cancer patients. This is Dr. David Grossman. He's a medical oncologist who works with us here in the CCAD Cancer Center.
Thank you, Dr. Grobmeier. So this PET scan is the latest state-of-the-art machine. It's a modality that we use to follow patients closely before and after their treatment to know whether their cancer is in remission and whether it has come back, and we can find out sooner than we did with older modalities. The real benefit of having it here is that patients don't have to drive so far to get the scan right now, and we can have it here close to where they live. It makes it easier for them, easier for their families to be with them, to support them, and then also easier for us because we can come down to the control room and look at images and ask questions of our radiologists and give our patients the best care close to home.
Thank you, David. We're back on the ground floor. This is where a patient's journey on a given day will end. But importantly, many patients who leave the center will need access to medications, which we now can provide in the pharmacy, which is in the building, so no longer patients have to move to another building or another location to get their medications. And many patients will also need lab work, and we provide that in the building also. So again, patients don't have to travel. I really hope you enjoyed the tour of this building. It's a promising time where we brought experts together in this state-of-the-art facility to bring hope to patients diagnosed with cancer in this region.